Hello, hello, hello. Good morning, good afternoon, and good evening. My name is Dr. James Ong, and I am your host. And every week we get to feature someone who may inspire you, either financially or in terms of health. And today we have a couple, very special guests, all the way from Sydney, Australia. And the husband suffered a pretty rare disease called the Poems syndrome. So before I introduce them, I would like to talk about the disease, Poems syndrome, and explain to you what it means so that you can better understand and appreciate what our guests have actually um, gone through. So, according to Mayo Clinic, this is their definition of Poems syndrome. Poems syndrome is a rare blood disorder that damages your nerves and affects other parts of your body. POEMS stands for these signs and symptoms. So it's an acronym, POEMS. Polyneuropathy, numbness, tingling, and weakness in your legs. And over time, maybe in your hands, and difficulty breathing. This is an essential feature in the diagnosis of POEMS syndrome. Organomegaly, enlarged spleen, liver, or lymph nodes. Endocrinopathy, edema, abnormal hormone levels that can result in an underactive thyroid, diabetes, sexual problems, fatigue, swelling in your limbs, and problems with metabolism and other essential functions. Monoclonal-protein, abnormal bone marrow cells, plasma cells, that produce a protein, monoclonal protein, that can be found in the bloodstream. This is an essential feature in the diagnosis of POEMS syndrome. Monoclonal protein is often associated with unusual bone hardening or thickening. And the S in POEMS stands for skin changes. More color than normal on your skin, red spots, possibly thicker skin, and increased facial or leg hair. The cause of POEMS syndrome isn't known, but people with POEMS syndrome have an increased number of plasma cells. These cells produce an abnormal amount of a type of protein which can damage other parts of the body. POEMS syndrome can be misdiagnosed because the signs and symptoms mimic those of other disorders. POEMS syndrome progresses rapidly. POEMS syndrome progresses rapidly without treatment and can become life-threatening. So early diagnosis is important. Treatment for POEMS syndrome might improve your symptoms, but doesn't cure the condition. Treatment options include radiation therapy, chemotherapy, and stem cell transplant. So here it says it doesn't cure, right? Well, we're gonna prove you wrong because we have this wonderful couple who more than willing to come forward to share their story. I mean, the wife had to experience the, pain of the husband who went through it. And wow, we wouldn't want to wish it for anyone. And if I may, invite them and introduce them now. If I can get them to turn on their camera and come on and share your story. All the way from Sydney, Australia, can we please welcome Maria Gonzalez sitting in front will be the
Yeah.
spokesperson, but of course behind is now the in Filipino we call it guapo or pogi, Angelito. Angelito Gonzalez. Welcome. Thank you so much for coming forward to share your story. I mean, it has been a very painful journey. I mean, we can laugh, we can joke about it right now, but it was really a lot of suffering that you have gone through, both of you. One is physically, the other one is mentally and emotionally. And well, thankfully, with this amazing iTera care, here we are, sitting, talking, sharing this wonderful result. Now, Maria, You have a lot to share, right? You have your
Yeah.
PowerPoint. Please take it over.
Yeah.
Tell us. Yeah.
Before I'm going to share our PowerPoint, I want to greet everyone. Good evening, good morning to every one of you now. I'm Maria Gonzalez, and this is my husband, Angelito Gonzalez. I want to express our gratitude to Dr. James Ong for giving us this opportunity today. It is an honor and privilege that we can able to share our powerful testimony with you all. And we hope that by sharing our experiences, we can bring joy and positivity in your lives. Now I'm going to share our slide. Oh, sorry. Wait, this is this one. Sorry.
Yeah. Go back to the first slide.
Yeah. Did you see it now?
No. You have to open the PowerPoint and then you share.
Okay. Zoom.
Don't worry, take your time. Everyone is waiting to watch.
Yeah.
Yeah. Okay. This is the Pogi before.
Yeah.
Mm,
Um, I want to share this testimony because I know that we can inspire everyone. Um, this miracle to my husband. That's why I call to my husband. That is my miracle baby. No, this
yeah.
picture, if you see, this is the last picture of my husband in a good health. It was taken February 2019. But after a few months, November 2019,
Hmm.
he started feeling weak and could not longer stand or walk on his own.
And may I
This,
ask, I mean, this happened like out of the blues, so suddenly kind of thing, very fast.
yeah, very fast because
Mhm.
he just only complaining regardless of numbness and hard him to walk on August.
Wow.
And when we go to the GP, they
Mhm.
told us, oh, that is ordinary for old man. You know what I mean? Just
Wow.
arthritis or
That
something.
means they couldn't diagnose. They didn't know.
Yeah, they cannot
Mhm.
diagnose that time. And
Mhm.
yeah, and then just only few August, September, and
Mhm.
October, he become very, very weak. That's why November, I bring him in the hospital.
Mhm.
And yeah, the health is continue to deteriorate until
Yeah.
April 2020.
Mhm.
He, when a series of heart attack lead him to spend almost an entire month in the ICU.
Wow.
During this
A
time,
series of heart attack. I mean, how many
yeah,
heart?
three times.
Three times, three heart attacks.
Yeah, three times.
Wow. So,
And
wow. I can see also the color of the skin is darker.
yeah, that's why
Yeah.
I'm so worried what's happening.
Mm-hmm.
And that time the doctor told us that we need to have a family meeting, just
Mm-hmm.
telling us that they cannot do anything for him because they cannot diagnose that time my husband because he's very, very weak and they cannot do anything.
So let me pause here for a moment.
Yeah,
The doctor says they cannot do anything.
yeah.
And what else did they ask you to do? Pray?
Pray. Just pray.
Just pray. Yeah, that's it.
And you
He
prayed,
has,
right? You prayed,
yeah.
and miracle happened, right?
Yeah. And that time he has a
Mhm.
14 aparato in his body.
Wow.
14.
And this is before iTera care. Huh? This is before
Yeah,
iTera. We just
before iTera.
okay, okay,
Yeah,
all
I
right.
just want to show you what's happening before
Yes.
we use the iTera.
So
Yeah.
a miracle happened even before iTera care, right?
Yeah.
Okay.
Yeah, that's why I know that there's a reason.
All right,
you know.
let's continue. Sorry for interrupting.
Yeah,
I just
it's all right.
I just
Yeah.
wanted to make it clear for our viewers so they understand.
Yeah. And then, yeah, the doctor told us just pray because the body of my husband is very weak. But
Yes,
luckily, just only 2 days. We don't know what's happening, but he recovered.
amazing.
From 14 aparato, go down to 6 aparato
Mm-hmm.
for that. And then, after his successful recovery, they transferred him to the hematologist department ward for further treatment and monitoring. During this medical evaluation, the doctor diagnosed him with POEM syndrome.
Okay, so
And
it took them a while before they
yeah,
were able to diagnose POEM syndrome. Yeah.
yeah, they try to get a lot of testing, blood tests and CT scan, everything.
Wow.
So they
MRI.
yeah, they
MRI.
got, I think that is called PETs.
Yeah.
And yeah, PETs
Mm-hmm.
test. Yeah,
Mm-hmm.
then after a while, the doctor told us that this is no cure for this
Wow.
disease. However, they advise us to try the oral chemotherapy. This
Mm-hmm.
is the last option that I can choose because some of the things that they try to introduce us is not good, much better to try the oral chemotherapy.
So
Despite of minimum, yeah,
you went for it. I mean, you have
yeah, we went for it
okay.
because there's no cure. We don't know what's happening for him.
So
So
try
that
na,
time,
try na, just try na. Yeah.
yeah, and if you see, this is the things that my husband can do, just only like that. The
Wow.
skin is so itchy.
Mm-mm.
He told me that he like a person with a tie in hands under the tree and eating by the ant because he cannot scratch his body. If
So
you see the
in other words, he has lost control. Most
yes,
movements around the legs and the hands and everything, he's lost control.
yeah, that's why he cannot scratch his body.
Oh,
Mm.
okay.
Yeah, and also if you see, he need to put a brace on his hand.
Mm-hmm.
He need
To stabilize.
yeah.
Mm-hmm.
But if you see the color,
Yeah.
the skin, everything is
Change na, change.
changes.
Uh,
It become ugly.
can you play the middle video if you don't mind?
Yeah, this
Yeah.
one. And you know what? Before he moved, the doctor told us that my husband will be disabled for the whole life.
Wow.
But they are amazed that he can move because they told me when he's in a bedridden, he cannot move anything. They told me, "Oh, your husband is hopeless. He cannot bring his arm up, but they are wrong." I told to my husband every day, please move your hand. And after a while, they move. You know what I mean? And the doctor is so amazed what's happening. This is no
I
iTera,
know, I know.
but yeah, but God is very, very good. If you can see, this is the start that he has having a drop foot.
Mm-mm.
If you see the foot,
Yeah.
it's
Yeah.
become wiggling.
Yes.
And he cannot stand by himself.
Struggle na, struggle.
Yeah,
Mm-mm.
yeah. And luckily, my husband
Mm-mm.
has a motivation to do a lot of things to back his strength.
Mm-mm.
But he stayed for the hospital for 1 year,
Wow.
totally 1 year, from
1 year.
November until
Oh,
November. Yeah, and then we will come back to our house. He tried to move, but But on November 26, 2020,
1 year later, after he came.
1 year, yeah, after from the hospital, November 26, 2020, he's dying.
So
Because,
they told him he's dying. They told him. They told
yeah,
I mean, sorry, they told you that he's dying.
yeah, yeah. The doctor told us he need an operation,
Mm-hmm.
but 90% he will die on the table.
Wow.
Or if not, he will be vegetable for
Mm-mm.
forever.
So it's a very risky,
Risky, very risky.
very risky. Mm-mm.
Another miracle of God. After 12 hours, when we talk this kind with the doctor came us and they told us, your husband healed by himself.
Well, I mean, just watching you explain his his will to live,
Yeah,
very strong, you know.
yeah.
He wouldn't give up, he wouldn't let go, even
No,
though at first the doctor said there is no cure, pray. And then later on, the doctor said you're gonna be like that for the rest of your life.
yeah.
I mean, wow. I mean, these are very discouraging words.
Yeah, and that's why I told to my husband, there's something God telling us. I don't know what's happening, but I know there's
Oh,
a reason.
okay. Next slide. Here comes iTera Care.
Yeah.
Oh, wow.
And then
Yeah.
after that, they continue the chemotherapy. This is every week. They
Mm,
inject the chemo for him.
mhm.
But one of my friend after Christmas called me and she told me, do you want to try the iTera care for your husband? And I told her how,
After Christmas. So this is
yeah,
this
after
late
Christmas of
after December
2022.
2022.
Yeah. And he
Okay.
told me, do you want to try the iTera care? And I told him, what is iTera care? Oh, people told us that this is very good. And I told her how to use it. She told me either, I don't know how to use it. Yeah, but just blow it. Then I told her,
Just blow
okay,
it.
yeah. I told her, okay, send the device. And then January 5, luckily I took the picture. This is January 5. If you see
Mm,
the hair of my husband is like
mhm.
this, just only 5 days. It's
Wow.
like this.
It,
Unbelievable, but it's,
it's like a different person, you know.
yeah.
Face.
And
Yeah.
we meet the doctor, the specialist, the hematologist.
Of course, he will not believe also, right?
Yeah, but he know my husband
Mm,
because we stay in the hospital for a year. He's the only doctor that we have on hematologist department.
They know who you
So
are. Yeah.
yeah, and that's why he took my phone just to
Mm.
see it is original.
Just
That
to
is
verify.
January 5. Yeah, to
Okay.
verify. And then
Yeah.
I talked to the doctor that time. That is last week of January.
Mm-mm.
I talked to her, Doc, can we please stop the chemo for a while? Just give me
Yeah.
1 month.
Mm-hmm.
Because you told me the chemotherapy, not 100% sure it will cure my husband.
And sorry, this was in January 2023.
Yeah,
Okay.
last week of January 23, because every last week of the month we need
Mhm.
to see
Chemo.
the doctor.
Mm-mm.
So if you see the last slide,
Mhm.
November, December, they took
Mhm.
the blood test of my husband. They called it cancer blood mark.
Yeah, marker. Yeah, cancer
Yeah,
mark. Mm-mm.
they took it 118.
Mm-mm.
The normal is 25.
Wow.
So I bring back to my husband, but he's a palliative case on that time. Okay,
Okay.
palliative case.
Mm-hmm.
So they told me, okay, I just only give you 1 month, but we need to check again the blood test of your husband to compare what's
Okay.
happening without the chemo.
So
After,
the cancer blood marker was 118. Okay,
yeah,
118. You stopped for
yeah,
1 month,
for
and
one
then
month, and we back on January, February, March, last week
March.
of
Wow.
March. Yeah.
What happened?
And you know what? From 118 go down to 38.
Wow, almost back to
That's one.
normal.
Yeah.
Yeah.
But the
Amazing.
doctor is
Without
still
chemo, without chemo, but
without
with
chemo,
with with
without
iTera care,
medication.
with iTera care, right?
Only iTera care.
Only iTera.
But
Okay.
that time we don't
Wait. This is
know.
exciting. This is exciting.
Yeah.
Did you want the water as well?
We
And
don't know the water.
you don't know the water, you just blow
We don't
everywhere.
know the water. We just
Okay.
blow, blow, blow.
Wow.
We don't know anything. We
Okay.
don't know the protocol.
Because the
We
person who
don't know.
introduced to you also doesn't know.
I don't know anything
Oh wow.
because
Okay.
in my belief, uh, this device is powerful. So
Amazing.
we use the device 30 minutes in the morning and
Mhm.
30 minutes in the evening.
Okay.
I concentrate
All over the body. All over the body.
30 minutes on the back in the
Mm-hmm.
morning and
Mm-hmm.
in front 30 minutes in the
Oh,
evening.
okay. All right. You
But we
covered.
don't know the protocol and charged water.
Okay.
Then after a few weeks, oh, they I researched in the YouTube that they need to charge the water. That is the time that I use the water and the protocol.
Okay.
Okay.
Amazing. Amazing.
Yeah.
All right.
And
Carry on with the slides. Yeah. Amazing.
yeah. And if you see, my husband has hernia.
Mm-hmm.
This hernia need an operation, and we need to see the doctor on March. And he told me, because my husband that time on March is it's okay. He told me, okay, we need to schedule the operation, because if not, maybe if he's become weak again, we cannot do again the operation. But
Okay.
when they check up my husband, the hernia gone.
Walana.
Wala na. So no operation needed.
Miracle.
And
Amazing.
yeah. And then I have no slide for this, but this
Mm.
is one things that I want to share. We went also to the heart specialist on March. Everything was March. We
Okay.
went to the hospital, to the specialist, to have a test to my husband. And after 2 tests, the doctor stopped the test and talked to me, telling like this: Mrs. Gonzalez, please help us to understand what's happening. I'm so nervous that time. And then
Mm.
I told him why. The doctor told, because according to our report, the heart of your husband is already defected since 2020. Why it become normal?
Wow.
I just told him I use the iTera care, and she told me, whatever you doing, please continue it. They stopped
Amazing.
the test because there are 3 tests that he needed, but only the 2,
Mm-hmm.
because everything is normal.
So when you say everything is normal to the heart, means what? The rhythm? Is it the ECG, or I mean, what kind of?
Everything because
Uh-huh.
everything because my husband stopped the heart 3
Mm-hmm.
times 2020.
He had 3 heart attacks. Yeah, 3 massive
Yeah,
heart attacks. So the heart is damaged basically,
yeah,
and now they tested it after your iTera care blowing.
yeah.
It's normal. Wow,
It's normal.
that's
And
amazing.
then after that, we need to see again our doctor, because I told him
Mhm.
again, please give me another. Did I told you that
One month, you
when
told, yeah,
1 month
Mm-mm.
from
Yeah, to 35,
118
to
go to
35,
38,
38.
the doctor is still not happy.
Oh, I
He
would be
told
happy.
me,
I would
yeah,
be happy.
yeah,
Yeah.
no, the doctor is like this,
Oh,
as he told me.
wow.
No, I think we need to continue the chemotherapy for him. I told him, Doc, can you please give me another 1 month, just another 1 month. And then she told me, I know you, Maria, you have a hard-headed. And then I told, yes,
Thank,
please give me a
thank God for
permission.
that. Thank God for
Yeah. And then after a while, after a month again, that is April 5,
yes.
the doctor told me, now I'm the one telling you, you don't need chemo anymore.
Wow. It has
It's
gone to
become
the
normal. Yeah.
normal.
And do you know Dr. James, what he
Mhm.
told me? Hey, Maria, are you still using the he cannot say the iTera, but she
Wow.
demonstrated. I told him yes, and she's the
Beautiful.
one telling me, please continue using it for him. Yeah,
Incredible.
but every 2 months, because he's okay now.
Mm-mm.
Before every 1 month, he need to go to the doctor. Now they give
Testing.
me only 2 to 3 months to come back, just to have a follow
Oh,
up for the
oh,
monitoring.
yeah.
Yeah, and also, if you see the skin of my husband is very dry,
Mm.
after 2 months it's become smooth.
Mm-hmm.
And then because of that, he can walk now and using the stir. Before he cannot walk, he cannot go stir, but look, after 2 months, he's
Mm-mm.
like a new man.
Yeah, January 5. That was the first blowing, yeah?
Yeah,
Oh.
January 5. And also he has a thyroid. You know,
Mm.
thyroid, you see
Yeah.
that everything is normal now.
Wala na, huh? Good.
Yeah, even blood sugar is
Normal.
getting better, normal now.
Wow.
And now he can cook.
Yeah. Amazing.
Yeah. Yeah, he can do by himself all the
Yeah.
things that he wants, the coffee or green tea.
He can control the nervous
Yeah.
system. Everything is normal. Yeah.
Yeah. This is the
Amazing.
one that we need to do every day. He has a carer because
Mm-hmm.
I told you that the doctor told us that he's a permanent disabled. That's why he was
Mm.
in a NDIS.
Okay.
So he has he need some carer for him.
Mm-hmm.
But doing a very good motivation, look,
Mm-hmm. Well, I think it's your will to fight on, Angelito. I think your will to live.
Yeah,
You never gave up. You never gave up, whatever they
yeah,
told you. Yeah.
yeah. Maybe I'm sure God have a purpose.
Yeah.
That's why.
Everything happened for a reason. So you have a
Yeah,
purpose. Oh, so this is a balancing, right? Tell us
yeah,
about the
yeah. This one is
balancing.
a
Yeah.
bit hard because the water moving.
Yes.
That's why it's a bit hard to
Mm-hmm.
control because of the water.
Because earlier you had a problem to balance yourself, right?
Yeah, yeah.
yeah.
Amazing.
And now he's now. Yeah. That's a
Wow.
very, very amazing
Mm-mm.
testimony to you guys because I want to share this
Mm.
because everything you're questioning how the thyroid is gone, kidney problem is functioning good, the
Mm-hmm.
heart is good, the pancreas is good,
Also,
and
Mm-hmm.
it's
our eyes.
and the eyes. You know
Ah.
what? Because his eyes is the nerves on
Mm-hmm.
the back of the eyes always pop up.
It's
Mm-mm.
no, yeah.
Yeah, and it's like a high blood or something.
Okay.
But when we go to the doctor told us your eyes is so healthy. It's come back
Wow.
also.
Mm.
Yeah,
By using the device.
You blow on the
yeah,
eyes also.
Yeah, yeah, yeah.
And
Amazing, very
amazing.
amazing
Really amazing. Yeah. Okay.
Yeah.
You can stop share now,
Yeah. But
Maria.
I want to share one more
Yeah, one more slide.
for
Okay.
me, for me, just only for me. Just
All right.
don't
Okay.
shock. This is my face when I'm not using the iTera.
Oh, you are a different person now.
Yeah, that's why I want to
Yeah.
share that it's
Okay.
also for beauty.
Yes,
Okay.
definitely. You look younger now.
Yeah, I know.
Amazing. Well, thank you so much for coming forward to share your story. And also, I'm so happy to see you
Yeah,
in
thank
such
you
an
so much.
back to normal,
Yeah.
like it never happened.
Yeah.
I guess.
And if you see also the hand before it's like this.
Yeah. And 1 year like this.
1 year with like this.
Wow.
I can play guitar now.
Yeah, he can play guitar.
Amazing. I was about to ask you to stand and jump, but no, it's okay. You don't have to do that. But it's just seeing you here and the color of your skin change and everything that I have said, in the beginning, the definition by Mayo Clinic of Poem syndrome. I mean, it's what you went through, your skin color change, your thyroid problem, your wow,
Yeah, everything.
or everything. Everything just shut down, isn't it?
Yeah.
And then with the blower and your strength,
Yeah.
your belief level, everything reverse.
Yeah.
Wow. Thank you. Thank you so much
Thank
for
you so much.
preparing all this and sharing it. I know you're not doing it for anything except you want to give people hope, especially
Yeah.
those people who are not having the best of health, but just have to believe. Am I right? Just have to
Yeah.
believe and just give it a try. Thank you so much,
Thank
Angelito,
you.
Maria.
Yeah. Thank you so much, Doc.
Very blessed to both of you. God bless.
God bless too.
Wow, there you have it. It's amazing, 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 amazing. So, okay, they have removed and all right. Well, that's it. Bye bye.
Medical disclaimers. iTera Classic and iTera Pro are not medical devices. The information provided on our website is for educational purposes only and does not substitute for professional medical advice. Please consult a medical professional or healthcare provider if you are seeking medical advice, diagnoses, or treatment. Prife International shall not be liable for risks or issues associated with using or acting upon the information on our website. Prife International shall not be liable or responsible for the actions, misrepresentations, or negligence of our members who are independent contractors.